Assalamu alaikum wa rahmatullah. The article of this week is titled Clinical Outcome of Guided Endodontics versus Freehand Drilling, a controlled clinical trial, single arm with external control group. It was done by Torres et al. In 2024, and the research question was, in teeth presenting with pulp canal obliteration, does guided endodontics treatment results in less technical failures compared to freehand treatment? So the aim of this study is to assess the clinical outcome of guided endodontics for the treatment of teeth presenting with pulp canal obliteration in comparison with freehand treatment. So pulp canal obliteration is a process characterized by the deposition of hard tissue within the root canal, and it presents most commonly as a result of traumatic dental injuries, and it was reported to develop more often in teeth following the concussion and subluxation injuries. Although the exact mechanism of pulp canal obliteration is still unknown, damage to the neurovascular supply of the pulp is probably related to this process. For the materials and methods, a total of 133 teeth were included. 60 teeth were treated with guided and 73 with freehand from 128 patients. For the inclusion criteria, tooth presenting with pulp canal obliteration and symptoms or signs of apical periodontitis. And for the control group, an external control group was selected from the clinical records of patients presenting with the same criteria of the experimental group but treated with freehand. And also they were treated from 2024 up to 2022. Guided root canal treatments were performed by the same operator in all patients. Free-handed treatments were performed by a specialist in endodontics under microscope with preoperative CBCT available. The primary outcome for both groups was evaluated as canal found, canal not found, or perforation. And as a secondary outcome, the qualitative accuracy of the drill path was assessed as optimal precision, acceptable precision, or technical failure. Then the patients were followed up yearly. Moving on to the results, the primary outcome for the guided group was 59 teeth canals found and 1 tooth canal not found. No perforations were recorded. In the free-handed group, the root canal was successfully found in 59 teeth, 7 were not found, and 7 had a perforation. Moreover, from all 60 teeth treated with guided endodontics, 49 presented an optimal precision with a centered drill path on 10 teeth, as you see from the X-ray from A to D, and an acceptable precision was obtained, and a correction was needed to find the canal, as you see from the X-rays from E to H. And 1 technical failure was registered where the root canal was not found. For the follow-up and dropouts, 13% dropout was found, a total of 44 teeth healed, 34 after the first year, 8 after 2 years, and 3 after 3 years of recall. 4 teeth showed signs of ongoing healing on the periapical radiograph, and 4 teeth didn't show any signs of healing after recall. 2 of them were scheduled for endodontic microsurgery. In conclusion, guided endodontics showed a statistically significant better outcome than free-handed treatment. It resulted in less technical failures compared to conventional treatment. However, it's a complex procedure which should be carried out by an experienced endodontist with the aid of a dental microscope. The limitations of the study include the lack of randomization, as patients were not randomly assigned to treatment groups, and instead they used a control group selected from a clinical database, which could introduce selection bias. Another limitation is the treatments in the control group were not directly controlled, and also for the guided treatments, they were conducted by a single operator to ensure consistency. This may limit the generalizability, as results could vary with different practitioners.